In this video, let us learn about heart blocks. Heart block basically means there is some kind of blockage in the electrical conduction pathway of the heart. The most common site of this blockage is the AV node. Now, heart block hence is also known as the nodal block to signify the AV node, or junctional block, the junction between atrium and ventricles. So this heart block, based on its severity, can be of three types: first degree, second degree, and third degree heart block. Let us one by one understand what is the heart block. Before that, let us understand the normal physiological function of AV node. So whenever an electrical impulse comes down to AV node from SA node, AV node causes a delay and then allows that impulse to get transmitted to ventricle. This delay that is caused in the AV node is known as the nodal delay. Nodal delay. This nodal delay is important because this gives a time difference between atrial depolarization and ventricular depolarization, and hence both the atria and ventricle don't depolarize at the same point of time, and hence after atrial depolarization the blood gets time to go into the ventricle before the ventricular depolarization starts. That is the normal function of AV node. This AV nodal delay can be appreciated on an ECG. This AV nodal delay on an ECG is represented by the PR interval. The ECG shows a P wave and then comes the QRS complex. So this is P, this is QRS complex. Now, P wave represents atrial depolarization, QRS complex represents ventricular depolarization, and the time duration between those two, the isoelectric part, that is the PR interval, is significant of the AV nodal delay. Now, a normal PR interval is any time less than 0.2 seconds. On the backdrop of this understanding, let us now move on to understand second degree heart block. In second degree heart block, what happens is that the impulse is coming from the SA node, gets a nodal delay and go down to ventricle, but in between that, certain impulses may lose their way and may not pass. Again, the next impulse gets to pass. So there is a sudden loss of one or multiple impulses which do not go to the ventricles. So basically, few impulses fail to propagate to ventricle. Few impulses fail to propagate to the ventricles. Now, how will the ECG look if this happens? Suppose this is the normal ECG, but in case of this scenario, there will be one P wave, as in case of the first impulse. Then there will be QRS complex. But over here, the second impulse in the image doesn't get passed to the ventricle. So there won't be any QRS. Then there will be the third impulse which gets a QRS. So there will be a missing QRS in between. So this will be the presentation of a second degree heart block. Right? Now, how second degree heart block precipitates? In a scenario of a first degree heart block, if you increase the dose of AV blocker that you're giving, a first degree heart block will get converted into a second degree heart block. Now, secondary heart block can be of different types. Now, in the first graph that you can get to see over here, you can see that the PR interval is progressively increasing. This is the PR interval over here, and then the PR interval increased further, then the PR interval again increased further, and this increase ultimately leads to, finally, there's a P wave, but after that, there's a lost QRS or QRS drop. So basically, there's a progressive PR increase, finally leading to a QRS drop. This type of second degree heart block is known as a Mobitz type 1. Type 1 of block. Then we can have another scenario where we have the PR intervals are fixed, but in the scenario of fixed PR intervals, there is a QRS drop. So fixed PR intervals leading to a QRS drop, this scenario is known as a Mobitz type 2. Or there can be another scenario where you can see that after every one P wave, two P waves, there is a QRS complex. Again, one P wave, second P wave, QRS complex. One P wave, second P wave, QRS complex. So after every two P wave, there is one QRS complex. So this is known as 2:1 block. Suppose after every X P wave, you get a QRS complex. Then in that scenario, it will be X:1 block. X will be the number of P waves before the QRS. So these are the subtypes of your second degree heart block.